Order. I will call Sonia Kumar to move the motion, and I understand you've agreed that another honourable member can make a contribution. I'll then go straight to the Minister, but there will be no opportunity for the mover to make a summing up at the end, as is the convention with half-hour debates. So, I call Sonia Kumar to move the motion.
Thank you, Chair. I'd like to state my thanks to give this opportunity to actually speak on this debate. As the Chair of the All-Parliamentary Group of Osteoporosis and Bone Health and an advanced practice physiotherapist and a first contact practitioner, MSK is my speciality, and I speak on this debate to discuss the provision needed to improve diagnosis and management of MSK conditions. My experience as an advanced practice physiotherapist is very much autonomous. And I don't think many people know that actually physiotherapists work from paediatrics all the way to elderly care, from nursery all the way to palliative care. And a first contact practitioner, generally, most people don't know what they do. And it's a new service for physiotherapists to work in GPs to actually diagnose, assess, refer onwards to secondary care if needed. And it's a really vital service that I was a part of at Dudley Group Hospital, so I'd like to declare my interest as working on the bank there. And it's not just MSK physiotherapists that are great in working in, across the hospitals, but in primary care, but also into tertiary care, and also in fracture clinics, into rheumatology, pain management, A&E. And I think not many people really realise that what we do. So when I talk about musculoskeletal physiotherapists and diagnosis, MSK physios are the specialists and experts at this, whether it's referring for x-rays, for looking for any suspicions for any fractures, whether it's looking for MRIs when we're looking for sinister pathology, or as a differential diagnosis for masqueraders that would be looking like for pancreas tumours, whether it's metastases, whether it's any other sort of cysts, or from a spinal point of view, or from a sort of multi-joint point of view. Whether it's ultrasound guided injections, prescribing, the scope of physiotherapists have expanded year on year to a point where there's now physiotherapists that are specialising and moving their practice on to start doing simple surgeries like carpal tunnel releases. Now, I look at not just the diagnostic point of view, but I also look at how important it is about managing MSK conditions. And that includes rehabilitation being the heart of Way.
Chairman, can I first of all commend the Honourable Lady for bringing this forward? In the press in the last few months, and probably in the last 6 months, there's been some very, very worrying trends in relation to children, for instance, as young as 11. So does the Honourable Lady not agree with that the NHS plan for change over the next 5 years is necessary when we consider that there are children of 11 years old being diagnosed with arthritis? And what we need in place is help and guidance for those who may live their lives impaired from a very early age right through all their life and in need of coping mechanisms. And the importance of this debate cannot be underlined enough. Thank you.
No, I agree. As having worked in paediatrics, a lot of patients and peds get diagnosed really late on and late onset. So it affects all of their life, whether it's from beginning, whether it's getting involved in physical activity, whether it's their mental health, building relationships, their sleeping pattern. And actually having the early diagnosis is actually one of the solutions that I would like to put forward to the Minister to consider, having physiotherapists look from early on, from nursery, looking at why we're not picking up MSK conditions from a really young age, and to provide health and well-being from the start, from day one. So I agree. Of course.
I thank my honourable friend for giving way. I really hear her point about early intervention and making sure that we're diagnosing MSK conditions as soon as possible. The reason I rise is I have a member of my extended family who suffers from pregnancy-related osteoporosis, which is again something which needs to be picked up as soon as possible so that appropriate treatment can be put in place and so those mothers can be supported through that. One of the things that is a very recent change in this area is there is now a new charity set up specifically for pregnancy-associated osteoporosis, and one of the things that they're pushing for is the Measure That Mum campaign to make sure that midwives are trained for this. They can pick up on these issues at that point as early as is physically possible. Is that something that she'd support?
Of course, as an MSK physiotherapist, one of the things we look at is spinal fractures. 70% of spinal fractures happen in the thoracic spine, and generally for women, older women that have poor bone health. So I think bone health and looking after that from a really early age while women are in their 40s is essential. So when they're going older in their 50s, 60s and 80s, that actually they are on the right medication. They are doing, exercises, including, bone health exercises to help for the future. So yeah, I think for MSK conditions and osteoporosis, physiotherapists are essential because spinal fractures are very much undiagnosed, and those people that have spinal fractures as they get older are more likely to then have a hip fracture and then have a hip fracture, and then the mortality rate's really high. So the Honourable Member makes a very good point. So the question I was going to put is, why is MSK physiotherapists and care important? So I'm going to give this Hall a explanation of why this is so important. By 2035, 2/3 of the population expected to have 2 or more long-term conditions, which includes MSK. Versus arthritis report arthritis and related MSK conditions affects 20.3 million people in the UK. So that's 1 in 6 with arthritis. That's a staggering amount. MSK conditions cost the NHS £5 billion a year, accounting to 1 in 5 GP appointments and 1.6 million hospital admissions, with 30 million prescriptions a year. People with low confidence and they feel they can't manage their conditions are more likely to attend hospital, while those that are most confident with long-term conditions have 38% fewer hospital admissions. Now, that's just about the economy and what we can do, but it's also about what first contact practitioners, as I mentioned at the beginning, which is that in first contact practitioners, we can save so many appointments for the GPs. And it's a part of the long-term plan, which sort of has been created to improve the impact on GP care and allied health professions that work within the GP. Working adults within MSK conditions are twice more likely to be economically inactive compared to those with long-term conditions. 21% of people that are economically inactive are due to ill health reported to MSK conditions. So it's not just about health, it's about the economy, and it's about well-being of a society that we're hopefully fabricating together as now in government. And I think it's really important that we're looking at this in a holistic way, because MSK conditions don't just affect somebody's mental health. It affects their relationships, how they're building relationships, whether they can get into bed and how they can sleep well and their sleep hygiene, whether it's the fact they're not eating sort of really poorly because they can't get out, so they're just putting lots of weight on, whether it's their emotion, their self-esteem, and whether they can able to work. And I don't believe that this is just a silver bullet, that if we just manage MSK conditions, it will just fix one part. It's got to be affected to all the facets of somebody and their general well-being. And we can't tackle waiting lists and return people to work without that. And I think we need a strong workforce to plough back into the economy. And it's so incredibly important for people to see that actually it's about the holistic management of this, and it's about how we can get health literacy better and self-efficacy better for those people with MSK conditions. So I come today to this debate to talk about solutions, as I'm a solution-led person. I think we need to recognise the AHPs, so allied health professions in the NHS, and build a workforce for MSK physios. And it's not just MSK physios, it's paramedics, it's podiatrists, it's every single person that's on those 14 professionals that are AHPs, that all will help with building resilience in the NHS, reduce waiting lists, and actually build a healthier society. I think MSK assessments should need to be from nursery, from day one. I don't think we can expect paediatrics or care to be delivered well and wait to the future and then look back and go, we should have done a better job when people were younger. If we look at MSK conditions from day one, about children's development, the early years of support, I think it'd be incredible for us to then go, this is not going to make a massive impact later on in society, where we're having to now do delayed diagnosis, multiple appointments, we're expecting people's general well-being. I also think we need to be embedding a society of what good health looks like from day one. You know, what does keeping active, going to classes, going to rehabilitation, what does looking well looks like? And I think we need to have a bigger awareness campaign on this. And it shouldn't just be, right, we get to leaving school and that's it, but it needs to be lifelong, just like we would do CPD. I think looking after your body and what that look entails like should be translated to health policy. I think we also need to increase physiotherapists in their scope and what they do in terms of practice. At the moment, physiotherapists don't do DEXA scans, but we look at bone health in every other way. We look at x-rays, we look at, you know, we work in fracture clinic, we work in, you know, rehabilitation in trauma orthopedics, but we don't do a part of the full picture of bone health. So I would request the Minister to consider whether this could be something that could be inputted in the future. I also think we need to increase the rollout of community appointment days, providing same-day service for patients to include assessments, advice, health promotion, rehabilitation, community and volunteer sectors to support in the non-medicalised environment. So when somebody comes in with a shoulder pain, a knee pain, or back pain, there is a one-stop shop for patients to come into and then be assessed appropriately and then move on to get their right care at the right time. I also think we need community service to be placed in high streets. And it's not just high streets, but actually putting in care into places of worship. Those people that we're not accessing, we've got massive health inequalities, but how do we get care and health promotion in places where those difficult to reach societies and communities? So I would love to see more care being put in to places of worship and those places that people wouldn't normally think of. I think we need to move away from hospital care, which I know that the government's already doing, and I very much welcome that. I also think we need to increase the number of FCP places. So a consultation with a FCP physio is £30 cheaper. It's £30 cheaper than traditional GP-led pathways. And MSK issues are one of the most common reasons to visit a GP, accounting for around 20 to 30% of appointments. And what I request from the Minister is to meet with me to discuss many more of the solutions that I think need to be put forward to managing MSK conditions, and also whether he'd be happy enough to visit my constituency to look at our fracture liaison service that we've set up, and I'm hoping that we'll continue to fund and roll out nationally. Thank you.
Lizzie College?
Oh, I'm sorry, Chair. I was told that I would not be able to speak today and that I would merely be intervening, but I am happy to speak if Mr Efford allows it.
I was told that you had been arranged to speak.
Well, excellent news. Mr Efford, thank you. It's a pleasure to serve under your chairship today, and I apologise for the confusion. Musculoskeletal conditions are very serious conditions, particularly when looked through the lens of health and social care workforce. So in Morecambe and Lunesdale, 27% of the sickness rates in health and social care workforce are caused by musculoskeletal conditions. It's clear to me that if we want to fix our health and social care workforce, then we must fix both the prevention, diagnosis and treatment of musculoskeletal conditions. As my honourable friend has pointed out, the impact of these conditions on people's life is not just the physical impact that they have perhaps on mobility or ability to work. The impact can be particularly serious on their mental health, on their relationships, on their ability to live their life to the full. I believe that health and social care and public health should all be framed around allowing people to live their absolute best lives. I believe it needs to be focused on enabling individuals, whether they have long-term health conditions or not, to work, to socialise and to have a good family life. I'm really passionate that as much as possible we can prevent ill health, prevent these musculoskeletal conditions that can cause a lot of pain and a lot of discomfort. And I welcome some of the proposals set out by my honourable friend, and I look forward to hearing from the Minister about the government's plans. Thank you, Mr Efford.
Neglected in the excitement to move the question that this House has considered diagnosis and management of musculoskeletal conditions. I beg your pardon, but now I have moved it. Minister.
Thank you very much, Mr Efford, and it's a pleasure to serve under your chairmanship. I'd like to thank my honourable friend, the member for Dudley, for securing this really important debate, and thank her for bringing her professional expertise to the floor of the House, and also my honourable friend, the member for Morecambe and Lunesdale, who shows that she can think on the spot and turn an intervention into a short speech. Mr Efford, it's important that we acknowledge just how significant the impact of multiskeletal conditions can be on both individuals and on their loved ones. Poor MSK health can severely impact every aspect of a person's life and also has a significant impact on the NHS and on the wider economy. Pain, stiffness and limited movement all affect quality of life and independence, including the ability to work. MSK conditions are the leading cause of years lived with disability in England. They are responsible for up to 30% of GP consultations, and MSK community services have the longest waiting lists of all community services in England as of September this year. MSK conditions are also one of the leading causes of sickness absence, with approximately 23.4 million working days lost due to MSK conditions in 2022 in the UK. So that is why this government is committed to improving care for the 17 million people living with MSK conditions in England and ensuring that they receive support and access to the latest treatments. Improving health and work outcomes for people living with MSK conditions also forms a key part of the government's missions to build an NHS fit for the future and to kickstart economic growth. So turning first, Mr Efford, to the health mission. My department recently announced plans to develop a 10-year NHS plan. This will consider what actions are needed to improve patient access and to reduce waiting times. It will set out a bold agenda to deliver the 3 big shifts needed to move healthcare from the hospital to the community, from analogue to digital, and from treatment to prevention. Now, we recognise that there is much more we can do to support earlier diagnosis and management for people with MSK conditions, and the need for timely and comprehensive care that starts at home. We know that many people with MSK conditions can be diagnosed and well managed in the community, and that's why we are making a start by exploring how best to support MSK primary and community service improvement, helping to give MSK conditions greater parity with other conditions. And Mr Efford, I will certainly take away my honourable friend's suggestions on physiotherapists, on AHPs more generally, and many of the other points that she's raised, as I think that they could play a vital and important role in getting the better outcomes that we want to see. And on, in one area, children, she speaks rightly about how we deal with children. This government wants to create the healthiest generation of children ever, and we have to ensure that we have the services, Mr Efford, to be able to diagnose bone conditions at an earlier stage and get children in the appropriate treatment that they may need. She also talks about difficult to reach communities. I have a row with my officials, Mr Efford, because I do not accept that any community is difficult to reach. We've just not tried hard enough. And it's precisely the kind of suggestions that she has set out as to how, on a whole range of health conditions, including MSK, that we need to do better at identifying where those people are, where those health inequalities are, and getting both the access to the services into the places where those people are, so we can get them on to the treatment pathways that we need to. Mr Efford, with NHS England, we are considering a range of options to identify the most effective ways of improving the quality of and access to the fracture liaison service model and the interventions that that model then provides. For MSK conditions such as rheumatoid arthritis, early diagnosis is key to preventing joint damage and to improving quality of life. The government is investing £1.5 billion in capital funding in 2025-26 for new surgical hubs and diagnostic scanners to build capacity for over 30,000 additional procedures and over 1.25 million diagnostic tests as they come online. Now, turning to the growth mission, the Get Britain Working White Paper highlighted the issue of spiralling economic activity, with 2.8 million people, that's the population of Greater Manchester, incidentally, locked out of work due to long-term sickness. Tackling economic inactivity caused by ill health will play an important part in reaching our ambition to achieve an 80% employment rate. To support this ambition, further Faster 20 will be delivered by the NHS England Getting It Right First Time programme. Further Faster 20 will operate in 20 areas of the country with high levels of economic inactivity, with the aim of reducing waiting times and enabling people to return to work. Actions will include improving secondary care interfaces with primary and community services. We will also launch a set of place-based trailblazers in 8 areas in England and Wales to run during 2025-26. The trailblazers will be at the forefront of developing joined-up approaches to support with work, health and skills. 3 of the trailblazer areas will be funded to become health and growth accelerator sites to build evidence of the impact of targeted action on the top health conditions driving economic inactivity, and I can assure the House that includes MSK conditions. I also want to say to my honourable friend, the member for Dudley, I am more than happy to meet with her to talk about these issues. I am more than happy if we can squeeze it somewhere in my diary to come and visit the fracture liaison services in her area. And I want to also reassure my honourable friend, the member for Morecambe and Loonsdale, that we take very seriously the impact of MSK conditions on the NHS workforce itself, and as part of our workforce planning, we need to get better at identifying those who are NHS employees who have MSK conditions and ensure that we have the appropriate support for them so that they can carry on working in our health and care systems as well. To conclude, I once again would like to thank my honourable friend, the member for Dudley, for securing this important debate. I hope she's reassured by some of the measures I've outlined today. I also will take on board the very important points that I think she's raised at how we can do better in these areas and ensure that they are fed back through my team to those that are working up our policies on fracture liaison and on MSK more generally. I hope that she recognises that this is a priority for this government. I recognise we must go further, absolutely. But today, I would just like to close by reaffirming this government's commitment to support the millions of people in the UK who are living with an MSK condition to ensure that they get the support they need, including improved diagnosis and management, that we drive down those waiting times and waiting lists, that we identify conditions earlier, that we get people into treatment as quickly as possible, and that we have that happier, healthier more prosperous country that we've all been elected to this place to help deliver as a consequence of having a healthier, happier workforce and a healthier and happier population. Thank you, Mr. Efford.
The question is that this House has considered the diagnosis and management of musculoskeletal conditions. As many as are of that opinion say aye. Contrary, no. I think the ayes have it. The ayes have it. Order. Order. The sitting is suspended until 2:30.